All measurements should be made on the right side of the body with the subject standing upright for the 7-site Skinfold test. Caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and finger, perpendicular to the skin fold and halfway between the crest and the base of the fold. Pin should be maintained while reading the caliper. Wait 1 or 2 seconds, no longer, before reading caliper. Take duplicate measurements at each site and retest if duplicate measurements are not within 1 or 2 millimeters. Rotate through the measurement sites or allow time to skin to regain normal texture and thickness. The first site is the triceps. Vertical fold on the posterior midline of the upper arm, halfway between the acromion and olecranon processes, with the arm held freely on the side of the body. The next site is the subscapular, which is a diagonal fold at a 45-degree angle, 1 or 2 centimeters below the inferior angle of the scapula. Next is the chest pectoral. It is a diagonal fold, 1/2 of the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and the nipple for women. The next fold is a mid-axillary. It's a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. An alternate method is a horizontal fold taken at the level of the xiphoid sternal border in the mid-axillary line. Next is an abdominal fold. It is vertical, 2 centimeters to the right side of the umbilicus. The sixth fold is the suprailiac. It is a diagonal fold in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. The final site is the thigh, which is a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease. After assessing the test, add up the sites and find the mean value. This mean value can be put into the body density equations. There's one for men and one for women. From the body density then can be put into the equations for body fat percentage, which can be conducted through the Rozek or the Seery equations.